Hi, I'm Dr. Daniels with The Joint, and we're going to talk about sitting. Sitting is making the news a lot lately. It's a very unhealthy posture to have. Some authors are calling sitting the new smoking. We're spending a lot of time in sitting. Eating, driving, at school, work, and watching TV. Okay, so we're spending hours and hours in sitting. Let's talk about sitting. I've got studies here by Panjabi and White. Panjabi and White are two Harvard physicians that did studies on disc pressures in the sitting position. So I want you to come down here and zone in on this, Mr. Fender. And right here, we're seeing the difference, if you can zone in, and we're studying disc pressures, if you can get that. Now, I've blown this up here, if you can come down to it, Jim. So what Panjabi and White found was when we were lying on the back, there was 25 pounds of pressure. On the side, it was 75 pounds of pressure. While standing up, it's 100. In any of my disc patients, I will keep the disc pressure 100 or less. Increased disc pressures cause more pinched nerves. When we bend over, it goes up to 150. But bending over at the chair is 185. Just sitting is 140, way higher than standing. Bending over with the weight, 220. Bending over with the weight on sitting, 275. So you can see that sitting all has higher disc pressure than standing. Here's the reason why. The normal lower back has a lordosis of a curve. So I can lay on my back, legs straight, and I can put my hand underneath it. Most people can. And that's because of the curve right here. When we sit, we tend to take the weight off the joints, which are back here, and pinch the front. We're pinching and putting too much pressure on the disc. It's not good for the disc. It's not good for the nerve, and it actually also causes, according to Panjabi and White, more muscle contraction back into the erector spinae, or the muscles that run up and down the spine. Now, a better way to sit, and the proper way to sit, is with the lumbar lordosis and using a lumbar support. Most cars nowadays have the lumbar support automatically built into them. So what does a lumbar support? If this is the person here, you want to put the support above the crest. It doesn't go down right on the seat. It will come up. So that lumbar support comes here. You also want to lean back about 10 to 15 degrees. And you'll notice it shifts the weight back more so on the joints than on the disc. So another study by Panjabi and White here. They're showing disc pressures higher here than leaning back with a 5 centimeter lumbar support.